Have you ever wondered why so many foreigners are fascinated by Brazil's healthcare system, while we Brazilians often disregard it?
So then he came and got me, and then we started walking out, and I was like, okay, so do I have to like pay anything? And he was like, no, it's free. That's what happens when you go to a public hospital. And I was like, what? It's free? I was like, okay, this is probably like the best feeling I've ever had, because I never experienced this type of feeling.
What are the foreigners seeing that we can't seem to grasp? Maybe it's time to stop and reflect. Is the real issue with the healthcare system itself, or with how it's managed? Because, let's be honest, what we have here is something that many developed nations can't even dream of offering. In fact, we even have many Americans praising Brazil's healthcare system. The Brazilian healthcare system, known as SUS, is free for 212 million Brazilians and any foreigner who needs it. Yes, you read that right, free. And it's this magical word, free, that impresses so many foreigners. While in the United States, for example, people have to pay a small fortune for a simple emergency service. In Brazil, access to healthcare is guaranteed to everyone, without exception. This sounds like a utopia for those living in a country where healthcare is treated as a luxury commodity. In Brazil, we have one of the highest tax burdens in the world. To give you an idea, Brazilian taxes amount to nearly 35% of the gross domestic product, GDP. This means that for every 100 reais generated by the country's economy, 35 go directly to the government's coffers. When we look at countries with a similar tax burden, like Denmark and Sweden, we see top-quality public services, including education and healthcare. Now, think with me, with over 1,900 billion reais collected in taxes annually, why isn't SUS among the best healthcare systems in the world? If the money exists, what's missing? Foreigners living in Brazil look at this structure and are amazed. Many know that if Brazil managed its resources efficiently, SUS could be one of the best examples of public health in the world. But what happens? Corruption eats away at the country's future from the edges. Now let's talk about the impact of this free service. In the United States, a simple visit to an emergency room can cost $1,000, which is over 5,000 reais. And don't think this is some kind of luxury. This is the price for basic care, without any more complex procedures. In Europe, countries with public healthcare systems, like the United Kingdom, offer something similar to SUS, but there are huge waiting lists and limitations. Still, in no other country is healthcare so accessible to everyone, rich and poor, without distinction. This is exactly what foreigners see with wide eyes in Brazil. The simple fact that a tourist can have an accident here and receive free treatment, something that wouldn't happen in many countries around the world, deeply impresses them. For many, Brazil is an example of how a country can be more humane toward its citizens and visitors. Now, let's address the big thorn in the side: corruption. If SUS is a free system, why isn't it flawless? The answer lies in resource management. Each year, billions of reais are diverted due to corruption in various areas of the country, and public health is no exception. It's estimated that 40 billion reais are lost annually to corruption schemes. And what could be done with that money? Imagine a SUS with state-of-the-art hospitals, well-paid doctors, and dignified, prompt care. Foreigners who come to Brazil observe SUS with a sense of admiration, but if they knew the behind-the-scenes reality and the amount of money that disappears, they would be equally shocked. Brazil could have one of the best healthcare systems in the world, but corruption steals not only the money but also the dignity of those who need care. What impresses foreigners is not just the fact that SUS is free, but also the concept that healthcare is a right for everyone. In many countries, public health is treated as a benefit rather than a right. In the United States, for example, there's a private system that treats healthcare as a product for those who can pay. If you have money, you have access to healthcare. If you don't, well, the situation becomes complicated. In Brazil, despite all the difficulties, anyone, rich or poor, has the right to receive care. Foreigners who move here notice this very clearly because they come from a reality where healthcare is not accessible to everyone. They understand how revolutionary this concept of universality is, ensuring that no one is left without assistance. This is something that both enchants and shocks those who come from abroad. So, the question that remains is, what is the future of SUS? Will it continue to be an inspiration for foreigners and a frustration for Brazilians? The potential of the system is enormous. With proper management, free from misappropriation, Brazil could become a global reference in public health. The resources are there. What's lacking is the political will to change this reality. Foreigners who love SUS see what we could be. They recognize the value of a healthcare system that, despite its problems, prioritizes human life above any economic interest. While we Brazilians often resign ourselves to the shortcomings, foreigners show us that with the right adjustments, we can transform SUS into one of the greatest legacies of our history. So, what do you think about SUS? Have you taken a moment to reflect on the value of this system? If you enjoyed this content and want to learn more about topics like this, don't forget to subscribe to the channel and leave a like on the video. Also, in the first pinned comment, there are 2 more videos you need to check out. See you in the next video.